Hi, my name is Caitlin Adamson, and this is my health assessment video for the entire health assessment. This is my patient, and I have provided privacy, done hand hygiene, and gathered my necessary equipment and obtained a baseline set of vitals. I'm going to have my patient identify herself.
KB.
And what is your birth date?
10/14/89.
I am going to check and make sure that my patient is alert and oriented ×4. I'm going to ask her why she's here for this visit.
Just a general physical.
Okay, and I'm going to just all this time be assessing her speech, making sure it's clear and appropriate, assessing her affect. She does not have a flat affect. She does not seem depressed. She looks clean and well-groomed, and her clothing is appropriate for the weather. I'm going to make sure that my patient is not experiencing any pain at this time.
Nope.
And I will start with my assessment, and I will just start from head to toe. So first thing I want to do is inspect her hair, the quality, if it's brittle, if it's dry, if it's clean or oily. And I'm also going to palpate the scalp and be just checking for any kind of lesions, lumps, or bumps. So her hair is clean and healthy. She does not have any bumps that are noticeable on her head. I am going to move on down. I'm going to take a look at her eyes. Courtney, do you wear any glasses or contacts?
No.
Okay, I'm just going to inspect her eyes. I'm going to look at her sclera, and it is white. I'm looking at her conjunctiva, and it is clear. I'm looking at the iris of her eyes, and they are round and they are equal. I'm going to take a look at her pupils are also 2 millimeters, and I'm going to test for accommodation. I'm going to shine a light in each eye and checking that her pupils constrict. Okay, and they are brisk and equal. And now I am going to perform an accommodation test, and I'm going to have her pick a spot on the wall, and then when I ask you to, I'm going to have you look at my fingers, and what I'm looking for is to make sure that her pupils are constricting appropriately. Go ahead and pick your spot on the wall. Okay, and when I ask you to, I want you to look at my finger. Okay, go ahead and look. And they both did constrict equally and quickly. I'm going to move down and take a look at her nose. Are you having any nasal discharge?
Nope.
Okay, no issues with nosebleeds or anything of that nature?
Nope.
Okay, I'm going to take a look at her nose, and it is symmetrical and it is midline. I'm going to take a look inside of her nose. Normally you would use a septum for this. And she does not have any drainage, and her turbinates look normal. I'm going to move on down, and I'm going to look at her mouth and look at her buccal mucosa, looking at her teeth, looking at her tonsils, her uvula, and her tongue. And I'll use my light for that too. And her teeth are all present. Do you wear any kind of dental appliance?
Nope. Her
tonsils are a 1. Her uvula is midline. Her mouth is pink and intact. No lesions are present. No obvious dental caries are present. When was your last dental visit?
Last week.
And did you have any issues?
Nope.
Her gums are pink. They're not red or inflamed. That could indicate like a gingivitis or something of that nature. Stick out your tongue for me. Okay, her tongue's midline. Wiggle it back and forth. Okay, and there's no deficits with that. You don't have any toothaches or anything
Nope.
like that. Okay, I'm going to take a look at her ears now. Do you have any issues with hearing?
No.
Do you wear any kind of hearing device?
No.
No earaches?
Nope.
Swimmer's ear?
Nope.
Discharge?
Nope.
Ringing of the ears?
Nope.
Vertigo?
Nope.
Okay. I'm going to take my otoscope, and I'm going to pull her pinna back and down and just take a look at her tympanic membrane, and a normal tympanic membrane is going to be like a pearly gray, whitish color. Put her hair back here. Her ears are clean. Okay, we'll do the same thing on this side. Her ears appear to be symmetrical as well. Okay. And her tympanic membrane is that pearly gray color, so we are good there. Next thing I'm going to do is move on down to her neck and just take a visible look at her neck and see that her trachea is midline. There's no deviation there. Her neck is not overly large. It is not overly short. I do not visibly see any lesions or lumps or bumps. So I'm going to just palpate her jaw and check her thomandibular joint. No clicking, no popping that could indicate TMJ. I'm going to just palpate and see if I can feel maybe any inflamed lymph nodes, which I can't feel. And while I'm checking these lymph nodes, I'm also going to palpate her sinuses and check for any kind of tenderness.
Nope.
No sinus issues.
Nope.
No history of allergies.
Nope.
Okay. I'm also going to palpate her carotid pulse. Okay, and it is a 2+, as was her temporal pulses. Okay, next thing I'm going to do is check her range of motion of her neck. So go ahead, side to side, up and down, in a circle. Any pain?
No.
Okay. Next thing I'm going to do is take a look at her chest. And it is symmetrical, it's not barreled out, it is not concave. Okay, I'm going to listen to her lung sounds and her heart sounds, and we'll start on this front side. When listening to lung sounds, what's important about that is that you can compare the right to the left, so you can notice any changes in sound. A lot of patients will have clear lung sounds up here and they'll be diminished in the bases. So we'll go ahead and take a listen to her lung sounds. We're going to do the outer third clavicle comparing right to left. Second, intercostal space right to left. Fourth, right to left. And sixth, right to left, right under the breast. And you want to listen for a full respiration. Her lung sounds are clear. There's no crackling, wheezes, bronchi, or any kind of coarse sounds present. And have you had any history of pneumonia, bronchitis?
No.
Any issues with hypoxia?
Nope.
Shortness of breath? Her nails are not clubbed, so that's another thing you want to look at when you're assessing a respiratory status. Clubbed nails could indicate past asthma, COPD, emphysema, any kind of issues that would be dealing with hypoxia. While we're on the front side, I'll go ahead and take a listen to her heart sounds. When you're listening to heart sounds, you are listening for your aortic, mitral, tricuspid, and pulmonic. At the pulmonic, or the apical, you want to assess a heart rate for a full minute, but for the purpose of this video, I will just do 30 seconds and times it by 2. And that will be second intercostal space, right sternal border, second intercostal space, left sternal border, fourth intercostal space, and then right intercostal space, midclavicular line. Alright, her heart sounds were all normal. There was no gallop, no rubs, no murmurs present. They were not muffled or distant. They were easily audible. Her heart rate's around 65. And during this is a good time to count your respirations. You don't want to let the patient know that you're counting respirations because it'll change their breathing pattern. I will also listen to her lung sounds on the back side, and also with that, comparing right to left. Okay, I'm also going to check for tactile fremitus. I'm going to place my hand, and everywhere I place my hand, I want you to say 99.
99. 99. 99. 99. 99. 99.
And again, here you're comparing left to right, and you can feel the vibrations when she repeats that word. Now I'm going to check for bronchophony, and this time I'm going to be comparing right to left again, having her say 99, only I'm going to be listening with my stethoscope this time.
99. 99. 99. 99. 99. 99.
And there you can hear the resonance and you can hear the vibrations. And to check for gophony, you would also compare right to left, having your patient say E and making an E sound. Next, I'm going to assess my patient's arms. I'm going to check for radial pulses and brachial pulses, making sure, comparing right to left, that they are even, easily palpable. By listening and palpating a radial pulse, her pulse is regular, so I wouldn't assume that she had any kind of dysrhythmias or anything of that nature. Her nails, she has a cap refill of less than 3 seconds. Her nails are not brittle, they're not clubbed. Her skin color is pink, consistent with her ethnicity. She doesn't appear to be cyanotic or anything like that. I'll go ahead and check the range of motion of your arms. So if you'll lift them out for me and put them back down, and then we're going to do abduction and then adduction. And we're just testing her full range of motion. And then I want you to bring your arms up like this. I want you to pull your arms to your body. Okay. And I'm just testing her muscle strength there, and she was able to overcome resistance against gravity. So now, Courtney, go ahead and lay down for me, and I'm going to take a look at your belly. So when looking at her stomach, I am looking first off to see the shape of her stomach. It is flat. It is symmetrical. Here you can test skin color a little bit better because this is generally an area that's not exposed to light as much. So her stomach is flat, her umbilicus is midline, and it is inverted. You can actually see a little bit of a visible pulsation, which is normal, and that's the aortic that you're seeing there. Next, I'm going to auscultate her bowel sounds, just checking that she has bowel sounds in all 4 quadrants. Okay. You can also auscultate vascular sounds, and what you're listening for is any kind of bruit, and you'll start and you're listening for the aorta just right above the umbilicus, and then you will move down and you will be auscultating the renal arteries, and then you'll move down and it'll be the iliac and then the femoral arteries. And you don't want to hear a bruit. That can indicate possibly an aortic dissection or something of that nature. Courtney does not have any bruit present, so that is a good finding. Next, we're going to do palpitation on her abdomen. And first off, I'm just checking for any kind of tenderness in any of the quadrants. Do you have any issues with not uncomfortable? And then next, if you want to palpate the liver, the spleen for the liver, you're going to come on the right side of the patient, about 5th intercostal space, midclavicular line. You can actually get your hands underneath kind of the rib cage there, and with each expiration, you can go in about 2 more inches to palpate that liver. It's very uncomfortable. It's a deep palpation. And that way you can kind of assess the liver borders. For the spleen, you want to come on the left side in between the 11th and 12th intercostal spaces. Normally you cannot palpate a spleen unless there is an abnormality present. The scratch test is another way that they used to say that you could check the borders of the liver, but science and research has proven that that's not so reliable anymore. But in order to do that, you want to listen, put your stethoscope down, and then you want to scratch the patient's belly And then where you can hear that scratching, more of a sound there, it is supposed to indicate the liver border, but research has disproven that theory. And you'd also want to assess your subjective information, last bowel movement, nutrition, things like that. She appears well nourished. Have you had any constipation, diarrhea, anything of that kind of issue? We will move down and do a musculoskeletal assessment while she's laying down. Have you had any pain in your joints? Okay. We will go ahead and assess your function of your legs. So go ahead and pull your knees into your belly, both of them. And then you can kind of feel right in the hip bone here and just make sure there's no crepitus of any kind. Okay. And she does have full range of motion in her legs, in her joints, her knees do not appear to have any sort of fluid on them. Go ahead and roll your ankles around for me, and then up and down, okay, and your toes. Okay, she has full range of motion in her lower extremities. Okay, go ahead and sit on the side of the bed for me if you don't mind. Oh, while she's laying down here, I will go ahead and assess her pulses so I don't have to have her lay back down just yet. So I will check her popliteal pulses, and again, you're comparing right to left. And then her post-tip, so that's right behind the ankle bone there. And then pedal pulses right on top of the foot. And those are 2+, easily palpable. It is regular, not irregular. Okay, go ahead and sit on the side of the bed for me. Okay, from here, normally you would have your patient stand, but since she's sitting, we'll go ahead and look and just take a look at her spine, and we're making sure that it's midline and that she does not have any type of scoliosis or kyphosis or anything of that nature. A lot of the times the older population will have a little bit of kyphosis, or a pregnant woman would have, sometimes in the later months, exhibit a little bit of kyphosis. Okay. We're going to go ahead and have you stand up here. And I want you to put your feet together, hands at your side, and I want you to close your eyes. This is the Romberg test, and you're testing for balance. If you have a patient that is neurologically impaired or a person that is intoxicated, they would have a very difficult time standing here for 20 seconds with their eyes closed. They would lose their balance. So Courtney is passing this test. We'll just assume that 20 seconds has passed by. Now I want you to go ahead and walk up to this table and turn around and walk back. And this is just assessing her gait. She doesn't have a shuffled gait or anything like that that would indicate a neurologic problem like Parkinson's disease or anything like that. So while the whole time we're doing this, we're assessing her muscle tone and size. We want to make sure a normal finding would be a 5, and that she has full range of motion against gravity with full resistance. Okay. Go ahead and sit down. We'll do your reflexes. You also want to make sure that their sensation is there. So you can use some cotton, and you can rub it along the skin of the patient's feet, hands, face, and just to check that their sensation's intact. And then to check if it really is intact, you could put it on one of the feet, right or left, and then ask them, am I touching your right foot or your left foot? That way, instead of, they couldn't fib out of that, I guess is what I'm getting at there. So Courtney, tell me which foot I'm touching.
The right one.
Okay, and now?
The right one.
Okay. And close your eyes. What side of your face?
Right.
Left. Okay. No pain, just a tickle, probably. Okay. There's also other neurologic tests you can do. You can do the stereognosis test, and in that test you would take an object, a familiar object that the patient would normally should know, such as a key or a pencil or a pen or something like that. You'd put it in their hand without them seeing it, have them close their eyes, and then you would want them to identify that object for you. Of course, identifying it correctly would be a positive finding. Identifying it incorrectly could indicate a neurologic problem. And then the graphesthesia, you would take your patient's hand, and with them closing their eyes again, you would write a number or a letter in their hand, and you would want them to be able to identify that for you. So we'll go ahead and do that.
3. Then. Do that again. P. O. 0.
Okay, so she passed that test. I'm also going to check her reflexes and make sure that they're intact. I don't have a thing. So we'll use this. Okay. Okay, and then I will check her reflexes lower here. Okay. And those all appear to be normal as well. Other neurological things you'd want to check would be for a Babinski reflex. In order to do that, you would have the patient stick their foot out, and you would want to run your thumb up their foot. And normally you would want to, in an adult, you'd want a negative Babinski reflex. In a baby, you would want a positive one. And what they do, a baby will do, is they will fan their toes out backwards with that motion. Courtney's not doing that, so it's a good thing. If she was, it would indicate a neurologic issue. You're also checking her coordination. The Romberg test kind of helps to check that. Then you want to do the rapid motion test, and what you have them do is perform something simple like patting your legs and then switching over and then just getting progressively faster with it. Okay, and you can see that there's a fluid movement there. Her coordination is good. Perfect. Okay, and another test you would want to do is the finger to nose test. So I'll have her close her eyes. Very good. And then another test you can do is go ahead and open your eyes, and then I want you to touch my finger, touch your nose. Touch my finger, and you can open your eyes. Look down there. Okay, you can see her coordination is good. So neurologically, pretty sure she's intact. And then go ahead and lay down one more time for me. We'll get our workout today. Okay, so this is the heel to opposite shin test. And so she's going to take her heel, place it at her knee, roll it down to her ankle, and she does it with smooth coordination-ish. Okay. Perfect. Okay, you can go ahead and sit up again. Okay, so it appears that, for the most part, Courtney's head-to-toe assessment is normal. Her neurologically, she's intact. Her speech is clear. Thought process is clear. She follows directions with smooth coordination, and has passed all of the neurologic tests. So this concludes my health assessment video. Courtney, do you have any questions regarding your health care today?
Nope.
Okay, thank you guys for watching.